Hi, it's Matthew Links, and today I want to give this short presentation on professionalism and self-care. It's designed for trainees in oncology, but it is broadly applicable. The framework that I'm going to use is the CanMEDS framework, which is the basis for most professional societies' approach to this problem, and it really highlights that to be an expert you need to be more than just technically competent. There are other domains or other roles, being a scholar, a professional, a communicator, etc., that are equally as important, and we need to identify these, we need to teach them, and we need to learn them. So the learning objectives today are to be familiar with the CanMEDS framework, and particularly how they relate to the Australian the physicians and radiotherapists curricula, and to identify the relationship between self-care and professional qualities, to identify some techniques that can be used to improve self-care, and some enabling values for professionalism. So why do we need to do this? Well, just imagine for a moment a clinically competent colleague that won't study or won't collaborate, that's a bully, that can't communicate, is lazy, or maybe they're just plain evil. Clearly, there's more to clinical practice than just clinical competence, and no one would want to work with or refer to such a clinician. The Australian College of Physicians has expanded the CanMEDS framework somewhat. There is a domain of quality and safety and one of cultural competency, and they've expanded the health advocate section to include the broader context of health. But however you cut it up, it's clear that there are domains other than clinical competence that are important. Now, what about self-care? CanMEDS also has a framework for this that highlights that in addition to our mental and physical health and our interpersonal relationships, there are central issues about our development as people and who we are as ourselves that are central to self-care. So an important question is, what is the relationship between caring for ourselves and caring for others? Are they complementary? Are they competitive? This is worth having a careful think about. But whatever the answer in that relationship, it's clear that professionalism is about who we are as people, and that there's an intimate link in between who we are as a person and who we are as a professional, between our self and identity and our professional identity. Now, the literature identifies a number of enabling values, such as integrity, excellent, commitment, humanism, and altruism, all values that promote professionalism. So I'd ask, can you think of examples of these values in action? How does this translate into day-to-day practice? And how do these values relate to care of ourselves? There are also a number of enabling behaviours or qualities that have been identified, such as reflection or mindfulness, cognitive behavioural techniques, or other behaviours. What works for you may be different to what works for other people, but there's a palette of options that have been suggested and promoted. An important aspect of the literature that speaks to this issue is that of positive psychology, which Martin Seligman and others have developed to identify evidence-based interventions for emotional health. And issues such as gratitude, a sense of community, a sense of meaning, these have been issues that have been positively identified with emotional health, and working and nurturing these in ourselves is an important way to improve our self-care. Life coaching is another approach. It might be something that you get someone else to do for you or something that you do yourself, but it's all about setting personal goals, developing strategies and monitoring progress, something that's very well done within sport or within the business world, but that in the professional world of health is not so well done. Cognitive behavioural techniques have very immediate application to many issues of self-care. Just think about when you've been angry at work. You can analyse that in terms of what you were thinking, what assumptions have been made, how you challenge those thoughts. And the same about when you've been worrying about work. These are techniques that can be very helpful for improving our self-care and can be worked at. Reflection is an underlying behaviour that promotes many aspects of improvement in our performance, in self-care and other things. A useful framework for reflection is the what, so what now framework. 3 questions that can provide a structure for reflecting on an activity. So, as an example, what practices help you reflect about patience, about how you're coping with stress, or about how you're doing with work-life balance? And can you think of an example where you've reflected on some of these issues and been able to change, and was that helpful? So as a group activity, now's a good time to form a small group, elect a spokesperson, and deal with the issue of how we can promote and teach self-care in our work environment. And then, as a personal activity, just write down a commitment or 2 for yourself that you can elect as a priority to develop for yourself and your professional qualities. What's the action and how will you follow up to be successful? So the key points are there's more to being a doctor than technical competence. Professional qualities relate to how we care about patients, our community and our colleagues. How we care about ourselves is linked to how we care about others. That self-care is a skill that can be developed in practice, and we need to teach, assess and model care for our patients, each others and ourselves. Now here are a few references that I've found helpful. Thank you for your attention and good luck with looking after yourself and developing your professionalism.